Hello, everyone. This is Dr. Mary Lauder, and you are listening to the Since You Put It That Way podcast. It's the show that examines various health, wellness, and medical topics from unique perspectives. We will be having discussions and guests that will cause you to pause and consider, well, since you put it that way. Hi, I'm Dr. Mary Lauder. Welcome to this episode of Since You Put It That Way. It's the podcast that causes us to stop and think, since you put it that way. We're going to dive deep today into a meaningful conversation that will challenge us to grow and I think allow us to thrive. And certainly, yes, you're meant to consider since you put it that way. Today, my guest is Dr. Arielle Schwartz, and she is a well-established and beloved psychologist and psychotherapist from the Boulder, Colorado area. And she is an acclaimed author as well, and the creator of the Resilience-Informed Therapy, which is a strength-based trauma treatment model that integrates approaches from EMDR, somatic psychology, mindfulness, and relational psychotherapy. With her decades of experience, Dr. Schwartz has helped countless people heal and grow. And she's also a therapeutic yoga instructor who masterfully weaves polyvagal theory into her practice. What truly sets Dr. Schwartz apart is her profound belief that trauma recovery isn't just about survival. It's about awakening the spiritual heart. Whether through her private practice, training for therapists, or her impactful tools, she empowers others to find strength and resilience in the face of life's challenges. Today, we're going to be diving into her insights on resilience, neuroplasticity, and how we can rewire our minds and bodies for healing and growth, even in the toughest times. So whether you're a therapist, someone on the healing path, or simply curious about the incredible potential of the human brain, but really more importantly, the human spirit and soul, this episode's for you. So welcome. And welcome to our guest, Dr. Arielle Schwartz. Great. Well, welcome, Arielle. It's lovely to see you. How are you today?
I'm well, Mary. Thank you. It's so lovely to see you again, too.
Good. It's taken us a minute to get this going.
It's true. It's true. We had starts and stops in our scheduling process, and it feels like right timing right now.
It does. It does because we're going to talk about resiliency. We're going to talk about how to grow, stand strong, thrive, and maybe even just stand in times of turmoil and in times of uncertainty.
Yes.
I think the ever-present constant would be change
Mhm.
and uncertainty. And humans, by and large, don't like that.
It's so true. It's so true. I saw this little nugget of a statistic that says that about 80 to 90% of what we do, say, or even perceive about the world around us is based on the past. So we're constantly trying to basically control our environment by using the past to try and predict the future. And yet the truth of the matter is that everything is constantly changing. There's this, constant river of flux as we think about it,
Yeah,
and we can never step in the same river twice, right?
right.
So, but at the same time, there's this kind of polarity. There's this tension between the need to control and manage and make things same so that I can feel safe. And then on the other side, the longing for change and evolution in ourselves and in the world around us so that we are not stuck in ruts of patterns that aren't serving us.
Right. Yes. Okay, that was like, okay, the end. Okay, I see our work here is done. Off we go. Off we
Well,
go.
you pulled that one out of me in the first 5 seconds, so
I
we'll see
thought
what
I
happens
thought we were going
next.
to go deep, but yeah, there we went.
We got deep in that river.
We did. We really, really did. So, and the type of therapy as a psychotherapist that you do is unique. The type of work as a physician I do is unique. And really, there's so many things that cross over with the type of work that you and I do for our patients and clients. And I found a quote on a website of someone I know, that would be you. And this is what your quote says: "We adapt to adversity by orienting to our strengths, attending to our pain, and taking charge of the narrative that defines our lives." I love that quote because I'm always telling patients that we have a story, and narrative medicine is so strong and so powerful, but we're also not our story.
Mhm.
We're who we are, we're what our story says has happened to us. And by and large, that can be disease patterns, that can be trauma patterns, that can be ups and downs, things where we go bump and land on our head, or things where we land on our feet. And but in that, what I've always found, and one of the things that's challenging as a physician, is the will to change, the desire to change, the desire to grow, the trappings of staying as a victim, or the, I don't know, you may be probably aware of the Cartman triangle of the victim, persecutor, and rescuer. And that's just the dysfunctional flow that happens all the time. But I think the underlying thing, reaching to humanity in the person, reaching to and teaching self-compassion, and then really finding within them that sense of resiliency of like, I can choose to be different. I can choose to have a different ending to my story.
Mhm.
And so that's a lot too. And even to get to being that type of a therapist or this type of physician was an evolution for ourselves. So, can you share with our listeners about your evolution, how you got to, the beautiful place you are and the type of work that you do?
Mm. Mm. I'm reflecting for a moment. I get asked this question a lot, and every time I get asked, I'm like, well, I want to share like a slightly different response because, one could piece together perhaps a whole bunch of interviews and get Arielle's life. But if I'm always telling the same story, well, then you only hear one. And the response that comes very authentically today is actually not so much about the adversities that I've faced that have helped me get here, but the people that have helped me get here, the people who have been sources of like really in-depth listening, in-depth presence, willing to see me so clearly, so compassionately, non-judgmentally, and that they have dramatically changed my life.
Mhm.
You know, I'm grateful to say that it's not just one, and I'm also grateful to say that they haven't all been therapists.
Yeah.
Some have,
Nice.
and like amazing, life-changing.
Yes.
And I tell this story in the post-traumatic growth guidebook, and it's also where that quote that you read comes from.
Mhm.
But one of those people that dramatically turned my life around was a complete stranger when I was 15,
Mm.
who took a risk to not only see me clearly, but to share with me as a complete stranger what he observed.
Wow.
Yeah, yeah, big wow. When I was 15, I was rather lost, if one wants to put it that way. I was, acting out, if that's the terminology that we use for a teenager. I was taking excessive risks and I was putting myself in some significant danger.
Mm.
And there were a few people at that stage of my life that actually saw the risk that I was in and spoke to me and almost like helped me see myself.
Mhm.
One was a teacher who saw that I had suddenly lost a lot of weight. And
Mm.
he just took me aside after class one day. I think I was in 10th grade. And he said, Are you okay?
Hmm.
You lost a lot of weight and I'm concerned for you. Like, wow. And it was a male teacher
Yeah.
talking to, again, a 15-year-old youth
Yes.
who was at risk. I was at
Yes.
risk. The other was that we had gone on a family trip, and this was a trip that we had gone to my with my grandparents, my father, my stepmother, my step sibling, and my cousins and aunts and uncles. So there were, I think, 13 of us that went on this family trip together. And I was suffering and I was very depressed. And out of that depression was acting out in some pretty concerning ways. And we're at a like a resort, right? One of these places. And I snuck out of the room that I was staying in with my cousins, and I had gone to the bar at 15 years old. I won't go into all the details of what proceeds next, but the next day I felt like just total crap. Like I just felt so down on myself. I did not see a future for myself. And I was sitting by myself by the edge of the water crying. And that complete stranger that had seen me the night before,
Hmm.
adult male, safe, trustworthy male, again, for a young 15-year-old girl, walked up to me and said, "You seem lost,"
Wow.
right?
And yeah.
And sat far enough away, but close enough, and just spoke in like metaphor. I called this man my guardian angel. He spoke
That's
in
what came to my
metaphor,
mind too, to be honest.
right? Like
Yeah.
truly. And he said, you know, there are times when we're like a boat on the water that's lost its point on the horizon. And if we don't have that horizon point, you're just going to continue to weave your way, and it takes, and you don't have a direction. You don't know where you're going. He said, you need to find your point on the horizon. Essentially, what I hear is, why am I here? Why am I on the planet? And not that I had that answer per se at 15, but it even gave me the sense of possibility that
Yeah.
I could find that.
Yes.
And we ended up talking for the next hour or so, or maybe longer. But this complete stranger totally turned my life around, or helped me turn my life around.
Mhm. Yeah.
And the felt sense that there was something larger than me, community, humanity, kindness,
Mhm.
that willingness to see and take action, something larger than me in a spiritual sense,
Mhm.
in a meanings making sense, that completely shifted my life from that day forward.
Wow.
Right.
Yeah. That's beautiful.
Yeah.
So that was almost like an anchor of hope
Yes.
because that hope has action to it. It's not just wishful thinking. It has a verb to its definition.
Yeah,
And so you've got to do something.
I did.
So that's
Yeah.
beautiful. That's
Yeah.
amazing.
Mm.
And then the movement, the yoga. So then did you go right into yoga? Was that one of your first forays or therapy first, then yoga? Because I kind of know you as the yoga therapist, psychotherapist, like extraordinaire. How did you pull this all together? That's kind of and,
Thank you.
and the funny thing is I literally connected with you in your website like 2 weeks before we moved from Boulder to Michigan. So
Mm.
it was the fun. I'm like, what is happening?
That's so funny.
And then coming back to
And then we meet in Arizona, of all places. So,
exactly,
yeah.
exactly. So, we're, in the ethers. But anyway, so what happened there, like with the yoga and the therapy and things like that?
Well, I had grown up, thankfully. Yoga was talk about anchors. One of my additional anchors, and also additional people that really served as a source of strength for me and resilience, is my stepfather. And he came into my life when I was about 5 and brought yoga with him. So he was a
Oh,
yogi. He
yeah.
was a seeker, is a seeker. He's still living. He's a very inspirational person in my life and really became an anchor for my mom and I both.
Mhm.
And and so we started going to ashrams when I was 6 or 7 years old, and yoga became kind of a lifestyle factor for us,
Oh, mhm.
in the sense that, like, for example, in third grade, he came every single Friday and taught yoga to my third grade class.
Oh,
And
cool.
it was so playful, right? Like we would be lions and roaring and trees and,
Hmm.
cobras and whatever creatures we would become in that process, but it was super grounding and rooting, and I loved it. And so I had this early influence, and then I became a teenager and really uprooted myself from any of that, and that was this 15-year-old phase that went on before and after a bit. And then I we have moments where I say kind of like coming to the surface and getting a breath of air, or kind of seeing even that horizon exists. And then we get kind of swallowed under again. And I think I went through several rounds of that surfacing and then descending again into some of my own wounds and struggles, but reenacting them in the world. And I had another round of that when I was first went off to college, and I was feeling a lot of depression, a lot of anxiety. And it was the first time that I went into psychotherapy as a young adult. I had been forced into therapy as a 7-year-old, which wasn't a great experience for me. It's kind of like a little bit of a humorous experience now, but not a good experience, not a good experience for a 7-year-old with a psychoanalyst. No, not
Yeah.
a good experience.
You know
Anyhow,
where your navel is to gaze at it. So it's like, do you know what a navel is to gaze?
it was just too heady, and I was such a sensory kid. I
Yeah.
would have benefited from play therapy perhaps, but not from that form. So anyhow, I go into therapy legit as an 18-year-old, and that really helped. That really helped give me just a like a meta reflection. It was very narrative. She was a Jungian analyst, but it was just right for that phase of my life. It was not somatic, but I felt so held and seen. And then maybe a year later, yoga came back in, and a friend
Okay.
of mine kind of like grabbed me by the arm, and she's like, "Oh, there's a yoga class at school. Let's go." And I went to this yoga class, and I felt connected to myself. Like,
Oh,
oh, there I am. Oh my gosh, where did Arielle go? There she is. And
oh,
and then I would go once a week, and then I started to do a home practice, and I started within a year I was practicing daily. Like it
oh,
became a
nice.
lifeline where every single time I practiced, I felt less anxious, more grounded, less depressed, more connected to myself. Hallelujah moment again.
Yes. Yes.
And I had some other experiences in body mind centering and somatics, like early flavors of the body playing a key role in my own mental health.
Hmm.
And enough of this to lead me to just like crave anything that I could that not only gave me that embodied felt experience of connection, but I had a very strong mental inquiry, curiosity that came in that said, I want to understand why this works.
Yeah.
That's what brought me to Naropa to study somatic psychology. It's what brought me to Boulder, Colorado. This was 1996.
Hmm.
And that same year, I did my yoga teacher training. So
Okay.
I was 22 when I completed my yoga teacher training, and when I started the somatic psychology master's program. And really, like from there until now, the last 30 years have been just like a hunger to continue to kind of not only link for myself and to offer practices that help other feel it, but to also offer the science about why this works
Hmm.
and to legitimize the value of body-centered work within clinical psychology and medicine.
Yeah. Yes.
Yes, yes, yes.
Yes, yes, yes. I guess it's going to be the choir preaching to the choir at this podcast today.
Yes.
Yeah, that's just beautiful because when, I think about movement as life, and as an osteopath, we're taught that. If we really look back at the true osteopathic teachings of A.T. Still, he was really a mystic, actually. And if I think about that, and then just the whole thing of, well, you've got to move lymph, you've got to move circulation, you've got to move your neural networks, you've got to move your digestion. So, I mean, we could like go down literally to the cellular level, and then we can come right back out. You got to move your feelings, you've got to move that energy, you've got to move your muscles. You've got to move your bones, and so and then you've got to move because it's, time to go. The rent is due. You've got, so there's movement everywhere, literally. The whole thing about life is movement.
Yes. Yes.
And then what we do is we get stuck,
That's
don't
right.
we? And
That's
so
right.
then inertia.
Yes, yes. Well, there's two sides to this equation. Sometimes I think we get stuck and we don't move, and sometimes we get stuck in movement to such a degree where we're actually so scared of inertia that I'll just keep moving, but now I'm moving in an unproductive manner. It's
Yeah,
like,
almost
oh, this,
frantic.
oh, wait, that, but it's
Yes.
all to avoid the potential that if I stop moving, I'm just going to go into the quicksand and I'll never get out.
Yes. Yes. I see that too, because
Yeah,
people just don't stop.
right.
And then if they do stop, or there isn't a stress, their guard goes down, because that equation they talk about, not 5% conscious, 95% unconscious. I'm not sure I like those numbers. I think it's a bit different number.
Yeah.
But the point is, we spend a lot of part of our consciousness trying to suppress.
Mhm.
And that can be through the frenetic movement or always being busy. And it can be also just going into not movement,
Yeah,
which is different than quietness, different than stillness, isn't it?
that's right.
And so, if we were to say, and how would you then jump right into something like resilience? I mean, because
Mhm.
people are like, resilience, man, I'm not even able to stand up today.
Mhm.
I just went in and put the covers over my head, went back under the feathers, as I say. And it's an important thing for us right now because we're existentially facing things. We're facing things within our culture
Mhm.
that I think, if handled correctly, will cause us to look inward to see what's our part to bring
Mhm.
about a better world.
Mhm. Mhm.
That's that's my personal feeling, but I also think that is also based in humanity and compassion.
Mhm.
So, what are your thoughts to get someone going either direction from too fast or not moving, and then
Yeah.
into kind of that resiliency, even if we can name that?
Yeah. Yeah. I love that you kind of went from one extreme into resilience, like you're at both extremes, and this idea of coming back to resilience and how far away it can feel. Like there's no way that I can go from not wanting to get out of bed and pulling the covers up or going and not wanting to stop. And like, how in the world do I get from either of those into this midline stream of resilient, responding, agency, a sense of control, sense that my actions make a difference in the world, right?
Yeah.
Those are some of the characteristics that we can describe as the resilient mindset. And I've spent, when I was writing the post-traumatic growth guidebook, I've been studying what are the factors associated with resilience. And the knowledge that it's not something that you're born with, it's not something that you just have or don't have. It is a set of skills and behaviors that can be learned and practiced. Okay, great. Then how do we get from here to here?
Right.
Some of it is the trauma work, right? Some of it is recognizing that resilience isn't just inside of an individual, it's about our direct access to support.
Mhm. Okay.
That, one of those factors, we call it control, but it's basically how much control do I have to know that I have access to the support systems that will help lead me to feel more resilient.
Mhm.
And, whether that's access to therapy, whether that's access to a yoga class, whether that's access to a book that I might read, right? A group that I might participate in.
Mhm.
And all of those things are good, but if I don't have the ability to access them, not so good.
Mhm.
So so part of it, sometimes it's financial, sometimes, we can look at some of the very realistic barriers to accessing those resources. But then there's an internal barrier
Mhm.
that we would call here more the loss of self-efficacy,
Mhm.
or the inability to sense that let's say there is that yoga class out there that's for free on Zoom or on YouTube that I might be able to take with someone like Dr. Arielle Schwartz, right? Let's say that's out there, but I can't get myself to it. Why
Yes.
can't I get myself to it? Because part of me believes that no matter what I do, it's not going to make a difference. Where did that come from? That's a historical experience. At one point, was it true that no matter what you did, it wasn't going to make a difference? Are you still looking through the eyes of that child part who is perceiving that to still be true in your world now? Could now be different from then. Well, I can't do all the things that she does in that class. Could you do the first 10 minutes?
Mhm.
Right? And notice how just 10 minutes of moving and breathing create a subtle shift or a not so subtle shift. Sometimes it's a very dramatic shift.
Mhm.
So some of it is about kind of working with those internal barriers of, you know, uh, it's not going to make a difference, or I don't have what it takes to be able to do that XYZ thing, or I'm scared of what I might feel if I do get in touch with my body.
Mhm.
So, I think that it's about finding the pacing of the process that works for you. But one of those resilience factors that shows up in every research study that I look at on resilience is the willingness to stay committed to the process, even if it's hard, right? It's the willingness to just show up. I mean, people come to yoga from all over the world, and sometimes people will show up and they say, I'm just coming to listen today and to feel part of this community.
Oh,
Beautiful. Do that. That's enough.
it's nice.
Yeah.
That actually just feels really good. Even that. Um, yeah. Do you think that those messages from when we were youngins, that's what I call us when we were little, the youngins, do you think those turn into like unconscious core beliefs?
Right. That are running the script in the background, the 95% of that iceberg under the water, right?
Yeah.
Yeah. And and what I love about the yogic practice is that so often we think yoga, physical movement, but yoga is a whole package. It's the whole thing, and it corresponds so beautifully with psychology, with psychotherapy.
Yeah.
So when we look at the practice of yoga, part of it is waking up or beginning to listen to those unconscious scripts that are running in the background that we adopted way back when and are still, at large. And once we can hear the voices that are saying, you're not enough, it's never going to change, you don't deserve it, right? And we can bear witness to it, that is a game changer as well.
It is.
Yeah.
I've learned a technique and I'm gonna I laugh about this because it's like surgery. Well, there's a surgical technique to take out your appendix. And there's a good way to do it. And you want to go in the front, not the back, right? Because of where things are. So location's important. But in psychotherapy, I don't know if location is important because it's different. Where are we treating? Where's the soul? Where's the consciousness? All of those things. The body holds the memories, the body keeps the score. All of that and our understanding is expanding so quickly and changing so quickly that, I hold it very openly and, gently. But to that point, the subconscious, I'm wondering, I've learned a technique that can, in theory, turn off those tapes. And I've become I've learned this technique, and I honestly have mixed feelings about it
Mm.
because I see it as a technique, but not as a standalone. Because sometimes folks aren't even aware of what they're feeling to know that it's coming from the subconscious.
Mhm.
And then if you share with them that that's what it is, and then like it's been living there with them, it's like, what's behind that door where that is? You know what I
Mhm.
mean?
Yes, for sure.
And then the other side, I'm going to go the other side of the pendulum, probably, where sometimes folks are in cognitive behavioral therapy or dialectical behavioral therapy or other types of therapy where 3, 4, 5 years they really haven't made a lot of progress.
Mhm.
Now, I see that in medicine too. I'm not trying to pick on anybody,
Mhm.
but and those folks end up in my office, chronic illness, really stuck, really stuck.
Mhm.
And my nature, my character is catalyst, change, transformation. It's the
Mhm.
type of physician I am, bar none.
Mhm.
And so sometimes you sandblast, sometimes you chip, sometimes you gently sand, sometimes you're just
Mhm.
indirectly over here and the patient's over there.
Mhm.
The question in that is, it looks like there's not any just one straight line through this.
Yeah.
What are your thoughts about that with people saying, here I've got this online, here I've got this online, 3 easy steps, 2 visits.
Right. And
Help
then the
help me break that
chronicity
down.
or the looping back or the regressing back into symptoms and why am I here again or how did I repeat this
Yeah,
pattern again?
yeah,
All of the above. So I think there's a few pieces that come to mind. One is that the complexity of our inner system is such that, as you said, we have these inner youngins, right? But we carry with us not just the belief, but the part of us that carries that belief. And so, this idea that we can just get rid of a cognitive process actually, in some way, communicates to the individual, we're going to get rid of a part of you. Well, what happens when we feel like any part of us might be exiled is it brings up more fear. We go, well, I don't want to lose that part of me. That part of me is here for a reason, or it helps me feel some sense of identity, whatever it might be. And so we
yeah,
hold on stronger. And the same misconception happens with EMDR. I've been an EMDR therapist for 22 years, and people say, well, you're going to get rid of this memory, right? Well, it doesn't really work that way. What
right.
we do is we fold into your overall sense of self that memory or that part of you. So the part that carries, let's say, unworthiness.
Mhm.
There's, I should have never been born. I'm not worthy of love. Look at all the examples in my life that show me that. And that this is this predominant experience of oneself. What occurs in those moments is that there's this phenomenal blending with the unworthy part. I'm
Mm,
still living inside of the unworthiness, and it becomes a self-fulfilling prophecy because looking out through the eyes of unworthiness, I'll find 1,000 examples to confirm it.
that's right.
But if we can get just enough distance, just like with the belief, we get enough distance and we go, oh, honey, that part that feels unworthy developed those feelings in such and such a context in these ways. Now, can I have compassion for the part of me that feels unworthy? All right. So now we've got this idea that there is the unworthy part and maybe a self, capital
Yes.
S, that can have compassion for that part that feels unworthy. It makes it sound kind of simple, and but it's not, and you and
It's
I both know this, because so often what shows up next is now we've got unworthy. We try and cultivate self-compassion, but what comes up instead? Rejection, disgust, repulsion. How dare you? I can't even look at that part.
yeah.
That part has held me back all of these years. So now we have other layers that come in, the part that's rejecting that young one that feels so unworthy. Now we get to work with another part. Where was that learned from? Who rejected that unworthy part?
Mhm.
Who criticized or couldn't have compassion or couldn't have softness, never made space for? Oh, okay. Well, that was a learned experience. So now
Right.
we have to differentiate from that often internalized parent, right?
Right.
Okay. So we've got this young one with unworthiness. We've got some separateness from the parent. Once we can separate what's restricting or blocking the compassion, maybe we can start to feel some softness, or we could imagine someone else that could feel that compassion for that unworthy part. Mary, I bet you could feel a lot of compassion for that unworthy part, even if I couldn't, right?
Mhm.
So we lean into the allies or the others on the path that
Yeah.
help us hold those parts. We don't ever get rid of the part,
Hmm.
but we become better at becoming protectors, nurturing, or a nurturer for that part that has felt so unworthy for so long. So that when another life event happens and she comes to the surface, we go, oh, honey, I've got you. You're my charge, and we'll get through this.
So you become then the protector right away, which is a mammalian trait, by the way. Mother bear,
Yeah,
lioness.
that's right. That's
Yeah.
right. Compassion has two forms, right?
Eh,
Fierce
Yes.
and nurturing.
Yes. And then just like the mama bear, don't go after the cubs. You're that bad news, you do that. And then as soon as the cubs are safe, she goes back getting huckleberries like she was.
Yeah.
We don't have that capacity as humans so much to go back to the huckleberries.
Mm,
We tend to stay in that trauma response where that's what I call it, a trauma response where it's not safe. You don't feel safe.
that's right.
And so you get that dysregulation, the autonomic dysregulation, the change in heart rate, change in blood pressure, change in blood sugar, change in weight, change in sleep pattern, all those things that go with that.
Mhm.
Looking at, EMDR, how that is one of the formative, foundational energetic psychology approaches.
Mhm.
Tapping, thought field therapy, EFT, another one, advanced integrative therapy. I came up with a self-compassion and connection that kind of blends a number of things and gets right to it. That I found that when a person is beset with anxiety
Mhm.
and really just beside themselves, literally,
Mhm.
that we can find that connection and
Mhm.
slow that autonomic response physically,
Mhm.
that then allows for what I saw emerge was, as you say, that sense of compassion for self.
Mhm.
Because all of a sudden you're like, oh, there I am. Oh, hello. I, I got you. We can do this. And, true to form, there are just some days that the best we can do is stand up and breathe.
True.
And I think accepting that and understanding and having compassion for ourselves in that point of time is super important.
Mhm.
And listening so that the voice and really our internal voice is what's guiding that, more
Yeah.
important than what's expected of us, what we're supposed to do, what
Yeah.
we should, the shoulds.
Mm. I had a thought that came up when you were speaking kind of early on in this about how hard it is for us as humans to get back to the huckleberries,
Yeah.
right? And that we're staying looping in those fear-based state, and the way that, of course, that is interacting with our autonomics and therefore our health.
Yeah.
And what has been so powerful for me, both as a yoga teacher, and I also teach classes in what are called vagal toning practices, which
Yeah.
is toning the vagus nerve, is that anything that we are trying to repattern in our mind, in our body, in our nervous system, in our emotional response requires repeated practice. It's
Yeah.
not a one and done game, right? It's kind of like
Yeah.
what we were saying before. It's not like the one magic session. We learn a tool, we learn a strategy, and then that the rubber hits the road when we practice that strategy every day.
Yes.
So that, whether it's your compassion practice or, whatever the thing is, my vagal toning practice, it's like brushing your teeth. It's kind of like, okay, wake up, do my practice so that I can create the mental hygiene that's
Mhm.
required
A mental
to
floss instead of
handle this.
dental floss.
Totally, like, okay, I'm gonna floss my vagus nerve this morning, right? And like, but it really does help with that resilience, because what vagal toning means is that we are helping create autonomic nervous system flexibility. What do I mean by that? With our autonomic nervous system, it has two branches. You and I know this, but I'm saying it for anyone listening,
Yeah.
right? It has the sympathetic and the parasympathetic. And again, we don't want to be stuck in anxiety. We don't want to be stuck in hiding in bed under the sheets. We want to be able to move between, you
Mhm.
know, feeling mobilized and ready to handle the day, that ability to move the lymph and the muscles and the bones, everything we said,
Yeah.
and the ability to go into rest and digest without going into collapse. So the tone of the vagus nerve is really about this ability to go back and forth between nervous system states with flexibility and fluidity.
Yes.
Okay. When we practice really simple techniques, we can strengthen that autonomic flexibility. And just like me going to that yoga class when I was 19, I felt better immediately. And then within a year, I had a daily practice because I liked how I felt. I felt less
Mhm.
anxious. I felt less stuck in my head. I felt less dissociated from my body. I
Yeah.
felt more at home. It's such an empowering place to be. I don't ever want to leave that home again. But of course, every day we get a little bit disconnected because life is hard.
Yeah.
And then we have ways to come back home again and again.
That's beautiful. So what I'm hearing you say is probably don't get a punch card for power yoga. I'm just saying.
It depends. I'm not anti-power yoga. I'll say that. I'm not anti-power yoga. So
Okay.
long as inside of that environment,
Mhm.
you feel like you've got a teacher you connect to, a community that holds you, a space where it's safe to be you, and that you feel like you can listen to your body inside of that environment. Great. If those ingredients are there, power away. And if if you go to that class and it's like, oh my gosh, so fast, and I have to match that shape and I can't even keep up with my breath, no go, right?
Right.
Find a class or whatever the practice is that allows you to be you, that
Yeah.
that gives you space for that authentic expression of you.
Yeah. So one of the things I do is genomic work, where we do their folks' genome,
Yeah.
not diagnostic, but
Right.
definitely shows patterns. And epigenetics, which is the environmental influence on our genes. And I was speaking the other day to a patient, and I'll tell you what, they do all power stuff. And they
Mhm.
were faced with their genome for the first time, and it was endurance.
Uh-huh.
And they're like, I don't even know what to do with this.
Mhm.
And it was fascinating because of the struggles that they were having and how they couldn't recover from their activity.
Mhm.
But the messaging when they were a youngin was you have to be like the boys. You have to be like this. You can't be who you are.
Right.
And we were able to, through our work together, to find that space of compassion for her. And
Mhm.
in that session, what was really just amazing was the autonomics changed. Her face changed, her skin tone changed, the blanching, the redness, the different things that occurred for just finding that connection again. And I, you know, and so it was just amazing to see that we were able to address that. And she's like, I think I'm going to go for a walk. I go, yes.
Nice.
Versus I got to hit the gym and do the circuits.
Right. I remember there was um, some set of literature that I'd come across, I think from my naturopath many years ago, that was some combination of like eat right for your body type, but it
Oh, yeah.
also had the kinds of exercise that were beneficial if you were an adrenal driver versus if you had, kind of other primary drivers in your system.
Mhm.
And it was so beneficial to really link type of exercise. And of
Yeah.
course, now with genetic testing, you can get super specific based
Right.
on your epigenetics and all of that. I
Right.
love that. I think that's a great story.
Yeah, and it's really fun because connecting then the patient to their story of who they are.
Mhm.
I said, let's just come back, keep coming back to that because the body has the inherent capacity to heal. Same thing. I think it's driven towards resilience. We're really meant to be more than survivors. We're meant to be thrivers. And I think knowing that we have agency. Maybe speak a little bit about choice and agency as you see it through your work, how to strengthen that with someone that they're not, a victim of their circumstances or their story, you
Yeah,
know.
yeah. I think that choice and agency have to be rooted in self-awareness. In the yogic system, we call this svadhyaya or self-study. In the polyvagal system, that I'm part of, we call it neuroceptive awareness, where we're bringing awareness to the state of the nervous system that I'm in, to what is kind of driving me from the background, so that if I'm going to build agency, I need to know what is coming out of automaticity or reactivity or habit, and or out of learned patternings that aren't necessarily in alignment, like the story you shared, with who I really am.
Yeah.
And so once we can kind of build that self-awareness story, then we can bring in the contemplation of what are the choices that are available to me now, what might occur if I were to do something different. And what I love about the process of change is it becomes a series of little experiments, right?
Mm,
Just because I'm trying something new doesn't mean that I have to wed myself to that too quickly either. I can experiment with a new way of being or a new way of walking or a new way of, a new way of showing up in the world. And I can notice now with that grounding of awareness, how did that shift how I
yeah.
feel in myself, in my body, in my emotions? And then we can keep fine tuning it, but awareness is always going to sit at the heart of that process.
Okay. So what do you think is the key for awareness? Is it yeah, I'm just going to ask, what's the key?
Slowing down.
Ah,
Slowing down to and being willing to be curious and to suspend judgment, right?
okay.
So often we jump from I'm aware of something and then I've got a story that jumps in that makes it good or bad. And if we can actually come back to slowing it down, because mind speed goes 10 times faster than sensation or body speed. So if I slow it down to stay with a sensation, I'll give a classic example. I'm teaching breath practice, and the breath brings up anxiety as soon as we bring awareness to breath. If we jump into the anxiety story, we have all of these narratives in the mind that tell us what's wrong with what I'm feeling when I'm connecting to the breath. So I don't want to do any conscious breathing. No, 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 that's not for me, right? Slow the whole thing down. First of all, when we look at breath practices, we literally have 30 different breath practices we could experiment with.
Hmm.
So if we broaden out that we could try breathing in different ways and see which ones actually bring you into greater calm and which ones trigger
Yeah.
that, no, 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 no. Or if we slow down the, I can't be with that sensation enough to be curious about it. Who couldn't be with that sensation? When and where did that sensation become too much for you? Why was it too much then? Can now be different from then. So it's a lot of the same practices around this. But if we can build awareness by slowing down, coming to the body versus the mind, suspending judgment, then we've got a little foothold into the change process, into the agency process, the choices.
Gotcha. Did you just describe desensitization?
Oh, that's always a part of the game, isn't it? Right?
Yeah.
Like, yeah, it's desensitization in 2 seconds flat. Like what, so much of what we do in this world is avoid things that are uncomfortable. And we build
Right.
phobias up around them, right? Like whether
Right.
it's the breath or going on an airplane. And the only way to come out of the phobia or the distress associated with something is actually to go toward it, right? We call it exposure therapy and
Yeah.
desensitization, but we need to go toward it at a pace that doesn't overwhelm us and reconfirm all of the worst case scenario thoughts,
Right.
right? So we move toward it slowly with newness of I'm safe enough now to feel that discomfort and know that I'm still okay.
Yeah. So, key takeaways. Change is always with us. Discomfort is a close relative. We can do it by slowing down or getting moving, wherever we're starting from. But we can do it by literally just starting and not holding judgment, being curious, and being compassionate. Does that sound about right?
It's brilliant.
Yeah.
Nice summary, Mary.
Yeah. Well, this has been a great conversation. I think I've had a therapy session. So thank you very much.
Thank you. Thank you.
It's just lovely to talk with you and to spend this time together. And I know our listeners will really love this. So I appreciate your heart. I appreciate all that you bring to the world and to your community. I'm glad that we're connecting. It's just fun and just wonderful. So thank you for your time today. I appreciate it.
Thank you. It just feels like the beginning of more, more
Yes,
connection. Looking forward to
I'll second and have seconds on that.
it. Thank you.
All right. Yeah. So we just finished up a great conversation, Dr. Schwartz and I, Arielle Schwartz. And, I'd like to encourage everybody to go over to her website at arielleschwartz.com. And she's got 8 books that she's written. She has webinars, she has teachings, she has retreats. It's a great resource. And she does yoga practice that you can follow on YouTube. And so there's either a nominal fee or it's without cost. There's both options. So I think availing ourselves to the things we talked about in this podcast is super important. So with that, I wish us all a very happy end of 2024 and onward, peacefully, quietly, with awareness, slowing down with curiosity and non-judgment. Enjoy the recording and enjoy connecting and or reconnecting with yourself and with those around you who are in your community. Be well. Thank you for joining us on the Since You Put It That Way podcast. Today's episode was written and produced by Crowded Table Productions. Technical editing, Malin Long Lopes. Sound editing, Jonathan Fiegel. Music, The River Jordan, written and performed by May Erlewine. Please rate and review our podcast as well. We appreciate your feedback, and hey, be positive, share the love.